I am not wearing pants right now, and I'm not ashamed to say it. I'm wearing shorts. But even more exciting than that is what I'm holding in my nimble little fingertips. Flanax. What the heck is this? Well, this actually isn't as foreign as it seems. I purchased this at a Mexican or a Latin American grocery store. It wasn't just Mexican, they had things from other, countries. And this is one of the medications that they had. Now, I love medications more than I love life itself. So I naturally bought as many as I could. And this is one of them. But I was fooled. Bamboozled, some would say. Because I thought, at first glance, this was a muscle relaxer. Flanax just sounds kind of muscle relaxery to me. But lo and behold, this is actually something you can buy at Walmart, probably. I know you can buy it at Costco. You cannot buy it at the Dollar Tree. They don't. Oh wait, they might have it actually. I think sometimes they have it at the Dollar Tree and sometimes they don't. But let's take a look at this together. Flanax. What an interesting name. I would be interested to know who thought of this, how they came to this particular combination of letters to name their product. Some say we will never know. Up here in the upper left, we have boldly and proudly displayed the NDC code. And I looked this up on Crush Cost. It is indeed valid. Crush Cost, if you didn't know, is also a medication information resource. So this is a registered product in the United States. Now, because I don't want to, how do I say this? Make it unfair for men everywhere. I will not be reading the Spanish parts of this package. Because I totally could. Just kidding, I cannot. We have a pain reliever here, folks. It is not a muscle relaxer. Longer lasting pain relief. Accurate. If we look at the top of this box, we have again the words pain reliever. But now, oh, I didn't realize it said it up there too. It also says fever reducer. And up here it also says fever reducer. "12 hours of pain relief." 12 hours. Is that accurate? Kinda. I think it's slightly misleading. And I'll explain why here soon. And on the front of the box we have naproxen sodium tablets, 220 milligram. Nation. Farm ASMR Nation. This is just naproxen. You can purchase this at Walmart. Naproxen sodium 220 pain reliever / fever reducer, actual size. I must say this is a very professional packaging. I mean top tier. 24 tablets. Is it within the expiration date? Indeed it is. I don't know which way is the most logical. Okay, probably start here, I think. Now we have the drug facts. What does this say? What does this say up here? This is the only part that... Oh my gosh. Folks, we have found a secret compartment never before seen by human eyes. I don't know what this says, but I see the word posterior. Maybe medicine, Spanish, and then a little symbol that looks like open, investigate. So here we go. Let's open, investigate this. Oh, sorry about that. Oh my gosh, that's so loud. Is there more? Doesn't look like it. And then here's the Spanish instructions. Interesting. Very interesting. This is a top tier package. They have hidden compartments with Spanish instructions. This is good stuff, folks. Now I am going to promptly close this because I cannot read it. But that is really cool. Active ingredients in each tablet. Naproxen sodium 220 milligram. Pain reliever, fever reducer. This is very confusing, and quite frankly, I wish packages wouldn't put this on here. It also says naproxen 200. Okay, that's the naproxen part, because remember it's naproxen sodium 20 milligram. If you consider only the naproxen part of that chemical, it's 200 milligram. Very confusing. I don't like that. And this is an NSAID, non-steroidal anti-inflammatory drug, which is a term I also do not like. Non-steroidal, thanks. It's also I don't know. It's also a non-chemotherapy anti-inflammatory drug. It's also a non-xanthine oxidase anti-inflammatory. I don't know. I just really don't like the term. It's not specific. I mean, it is specific, but the fact that it's not a steroid doesn't need to be in the name of the class of medication. Why don't we do that for other things? Anyway, this blocks an enzyme called COX. And when you block that enzyme, a couple things happen. One, it reduces inflammation. thins your blood a little bit. 3, it can cause ulcers to form in your stomach. These are all the effects of blocking that. It's actually 2 enzymes. There's COX-1 and COX-2. These are all the effects of that. But the only one we really like is the anti-inflammation part. This is very similar to ibuprofen, if you've heard of that chemical. It's very similar. Now, the most relevant difference, in my professional opinion, is that naproxen does last longer. And that may be a good thing or a bad thing, depending on what you're trying to do. I have taken naproxen myself, and I really didn't even notice it did anything at all. But I have taken ibuprofen before and felt much better. That is just my personal experience. That is not a clinical opinion. A question I've always had about naproxen is, obviously you can buy it in the United States without a prescription. They make a liquid, but you need a prescription for the liquid. Why? Who is making these decisions, and what is their logic? You can buy ibuprofen liquid, no problem. I've always wondered that. But then I stop myself from wondering because I know that there is no answer. Uses: temporary, relieves minor aches and pains due to minor pain of arthritis, backache. Now, for muscle-related pain, I think acetaminophen is actually better. I think most professionals would agree with me there. I don't think that's a controversial opinion. Muscular aches, headache, yes. Okay, so for headaches, this is what I say about headaches. It seems like everybody's different. There is no the best headache medication. What works for one person may not work for another. And you pretty much just gotta try things until something sticks. Menstrual cramps. The common cold. Okay, so look, this is the fight I have been having for the past year and a half or so making videos. Up here we have clinical fact, and it's very hard to understand. When you simplify it a little bit, that's okay. But sometimes it can still be very difficult to understand. You know what I mean? And if you simplify something enough, it becomes incorrect. And this is the struggle that I think myself and anyone who wants to educate the general public, where do you find that perfect balance? And it's I don't know. I mean, that's why, some people may be more successful than others at doing things like educating the general public, entertaining. I don't know. Lots of different fields require clinical, or I guess in this case, professional expertise. If I said naproxen treats the common cold, that is an incorrect statement. The common cold is a virus, and an NSAID, naproxen, any of them is not going to help. It does help with fever and aches associated with the common cold. But when you just simplify it to one bullet point, the common cold, it doesn't, it's not correct, really. So, that's my qualm. Folks may see a video and say that's wrong, and it's like, well, yeah, for you, because you're a professional. For somebody who is just trying to help their kid or whatever, it's perfect for them. Toothache temporarily reduces fever. Why'd they put temporary here? Does it permanently reduce headache? Does it? No. Very odd to me, some of the wording that we accept. By the way, every word on here, because this is an American product, is verified by the FDA. There is literally a website where everything that you're seeing here has to be copied and pasted on every naproxen OTC product. It's a federal requirement. Allergy alert. Naproxen sodium may cause a severe allergic reaction, especially in people allergic to aspirin. Aspirin is also an NSAID. It's in the same class. Symptoms may include hives, facial swelling, asthma. What? Could it by definition cause asthma? I'm not really sure. But it would be an asthma-like state for sure. Shock. What type of shock? There's different types. Skin reddening, rash, blisters. If an allergic reaction occurs, stop use and seek medical help right away. Here you see the stomach bleeding warning, what I mentioned earlier. This product contains an NSAID which may cause severe stomach bleeding. The chance is higher if you are age 60 or older, have had stomach ulcers or bleeding problems, take a blood-thinning anticoagulant or steroid drug, take other drugs containing prescription or non-prescription NSAIDs, aspirin, ibuprofen, naproxen, or others, have 3 or more alcoholic drinks every day while using this product, take more or for a long time than directed. Heart attack and stroke warning. NSAIDs except aspirin increase the risk for heart attack. Heart failure and stroke. These can be fatal. The risk is higher if you use more than directed or for longer than directed. Do not use if you have ever had allergic reaction to any other pain reliever / fever reducer. Right before or after heart surgery. Ask doctor if the stomach bleeding warning applies to you. You have a history of stomach problems such as heartburn. You have high blood pressure, heart disease, liver cirrhosis, kidney disease. It can also be rough on the kidneys. Asthma or had a stroke. You're taking diuretic. You have problems or serious side effects from taking pain relievers or fever reducers. Ask a doctor or pharmacist before use if you are under a doctor's care for any serious condition, taking aspirin for heart attack or stroke because naproxen may decrease the benefit of aspirin. Taking any other drug. I mean, that bullet point right there pretty much encompasses everything else, right? It's not our fault. We put a warning on here that says taking any other drug. Again, this is given by the FDA, though. The warnings, that is. This is the main difference, folks, between this and ibuprofen. Take 1 tablet every 8 to 12 hours while symptoms last. This is 220 milligram, right? For the first dose, you may take 2 tablets within the first hour. Do not exceed 2 tablets in any 8 to 12 hour period. Do not exceed 3 tablets in a 24-hour period. So going back to the beginning where it says 12 hours of pain relief, yeah, it could be. Or it could be 8. Ibuprofen does not last as long as naproxen. That's the main difference. Got a couple other doodads here for inactive ingredients. And it is made in Arlington, Virginia. Wait, no, it's distributed by, it's made in India. That's so loud, I'm sorry. Now, I opened this previously, that's why the box is open. But let's take a little look-see. I mean, I am just tickled to pieces about how professional this is. My goodness. This is the Spanish portion of the label. So this company appears to be the naproxen of choice for Spanish-speaking people. They took a product that exists already and they made it different by giving people who speak Spanish more access to it. I like that. That says 6-7 there. What's it say on the other side? My hands are clean, don't worry. J. I can't get that to focus. J67. Very beautiful. There you go, folks. Flanax and the Panax.